Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Today, we're diving deep into a topic that affects us all, aging. But don't worry, we're not talking about wrinkles and grey hair. We're talking about how to maintain our physical and mental health as we age. Joining me to explore healthy aging is Dr. Thakhani Khorombi, who will share insights on how to live a healthy and fulfilling life at every age.
Thank you for having me here. So I'm Dr. Thakhani Khorombi, and I am a general practitioner. I'm also a public health enthusiast. So what do I do? Basically, mostly primary healthcare services. So I have my own practice where I offer in-person and also virtual consultations. And I'm also a big fan of health education, which I try to do on social media. That's me in a nutshell.
Thank you so much for that lovely introduction, Dr. Thakhani. I guess let's move on to what we'll be discussing today, healthy aging. Can you just mention some of the most significant changes that occur in our bodies as we age?
As we age, our bodies experience a range of changes that some are visible externally, but some are quite internal. So some of those changes are with regards to your musculoskeletal system, your cardiovascular system, changes in your metabolism, and also changes in your skin, cognitive function, and your immune system. Perhaps just to offer a bit more examples, when you look at the musculoskeletal system, your bone density gradually decreases, which can lead to conditions like osteoporosis and making you more fragile or prone to fractures. Another example, perhaps with the cardiovascular system, is that your heart muscles actually become a bit stiffer and your arteries can also thicken and narrow as well. And this causes an increase in your high blood pressure and also just increasing your risk of experiencing cardiovascular diseases as well. Something that perhaps a lot of us notice a lot is skin changes. Your skin loses elasticity and moisture, and this is what leads to the wrinkles and the dryness and also thinning of skin. This also causes a reduced ability for the skin to heal, and thus making it susceptible to, injuries and infections. These are just some of the examples that can happen as a person ages.
With those changes in mind, how can we differentiate between normal aging processes and signs of potential health issues?
It's quite important that we understand what normal aging is, and then also to be able to recognize and identify when, there's a potential health concern. So with your normal aging, there tends to be this gradual changes that, there'll be the slowly progressive, perhaps joint stiffness, or this occasional forgetfulness. Versus if there is a potential health condition that's ongoing, you might find that, someone has a sudden or rapid changes in their cognition, like sudden confusion, having intense pain. Some people even get this abrupt weight loss. And this could be signs of, maybe there's some bit more deeper than just a normal aging process. And I think some of the things that we also need to look out for is the type of impact that, these changes have on daily life. So mild forgetfulness or occasional fatigue might be part of normal aging. But if the memory loss then begins to interfere with the daily activities of the individual or decision making, this can be an indication of things like, dementia, which needs to be investigated because that is a health concern.
What are the most common mistakes people make in trying to maintain their health as they age, and how can they be avoided?
Some of the most common mistakes that people make, I think something like neglecting physical activity. A common mistake is to actually become more sedentary and just assume that, it's less important now that I do any physical activity because I'm aging. But actually, there is benefits to staying active because it helps maintain your muscle mass, your joint flexibility, and also improves cardiovascular health and also an individual's mental well-being. So simple activities like walking or yoga can actually be quite beneficial. Another thing that I've picked up, and I think I've also picked this up from my father, is that there becomes an over-reliance on supplements. And whilst supplements can actually play a good role in health, because as people age, some people do start having deficiencies. But the problem comes when there's an over-reliance on them without a proper medical guidance. And then this can lead to toxicity or bad interaction with the other medications that the individual actually is on. And I think one other big thing is ignoring mental health. Mental health is overlooked in aging populations, but actually they also suffer from your depressions, your anxiety, and even just, that social isolation. Because when people tend to age, we tend to leave them on their own, but that actually can affect their mental health in the long run. And these things go unrecognized because we just assume, they're getting older, so they probably like being alone and all those things, but they also do experience depression and anxiety as well. Another thing is having poor dietary choices. So some people do resort to convenience of food, and there's always this thing of, but I've been eating like this my whole life, so what's the point of changing things now? But then they end up having health issues like your hypertension and your diabetes as they get older because they do not focus on having a balanced diet, which is obviously essential for the aging process as well.
Dr. Thakhani, I know you just touched on it, but building on to my next question, what are some important lifestyle changes people can make to continue to promote healthy aging?
Some of the changes that can promote healthy aging and also enhancing the quality of life is focusing on good nutrition. Having a diet that's rich in fruits, vegetables, whole grains, and lean proteins, it supports an individual's overall health. And also being able to stay hydrated and limiting the processed foods that we get nowadays because we want to reach for convenience. But that also helps to improve the aging process and also decrease the risk of this lifestyle diseases. Another thing, like I mentioned earlier on, is that people tend to neglect, physical activity. But actually, the regular exercise is vital. It can include anything from taking a walk, strength training to maintain that muscle mass, and just even flexibility exercises like your yoga in order to be able to improve those joint mobilities and also reduce the risk of falling. Something that's also important is having a quality sleep. It's because of the type of environment that we are in now. Sleeping for more than 7 hours is like, oh my gosh, why are you still sleeping and all those things? But as you grow older, quality sleep is actually quite important because it allows your body to be able to repair and regenerate. Just being able to maintain that good sleep hygiene practices is actually beneficial. And something else is also having a good way to manage stress, because chronic stress can accelerate the aging process and contribute to a variety of health problems. So having techniques that help improve your stress, doing things like meditation, breathing exercises, and also continuing to have hobbies even as you age can actually help manage stress effectively.
Just to wrap things up, can you just advise on the benefits of regular health screenings and which ones are particularly important as we age?
Having regular health screenings offers several key benefits like the detection of diseases, prevention of complications of those diseases, and just also an overall peace of mind. Things like cardiovascular screenings, going for regular blood checks, cholesterol levels, and also glucose tests. These are quite important for assessing if someone has a risk of heart diseases and diabetes and being able to manage those at an early onset. There's a risk for certain cancers that increases as we age. So screenings with things such as mammograms for breast cancer, having colonoscopies done for colon cancer, and also prostate exams for prostate cancer, also getting pap smears done in order to screen for, cervical cancers. These are very important as they can be able to detect, the cancer at an early stage and possibly at a point where, it is still treatable. I think something that also we tend to just overlook is getting vision and hearing tests, right? Because we just go, they're aging anyways, they're not supposed to see or hear or whatever. But actually, regular eye exams are also quite important. And these can detect, things like glaucoma, cataracts that can affect a person's vision. And in terms of hearing tests as well, they can detect early hearing loss. And also referrals can be done to help improve the quality of communication between the individual and, their families or their environment as well. And I think just one last thing is also having, cognitive assessments. These are not necessarily part of standard screening assessments, but they can also help us to detect if there's any signs of dementia or any other cognitive disorders, allowing again for early intervention.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. Aging is a natural part of life, and with the right approach, we can maintain our physical and mental health, ensuring a vibrant and fulfilling later life. Remember, it's never too late to start. Whether it's incorporating regular exercise into your routine, nurturing your mental health through mindfulness, prioritizing a balanced diet, or having regular health screenings, every small step counts to reach the potential of healthy aging. Stay healthy and fancy. I am your host, Candice Kumalo. Until next time.